Hi, my name is Dr. Burke. What's your name?
Kira.
Nice to meet you. So today I'm going to start off with telling you a little about our office. We're going to go over our goals and our philosophy. And then after that, we're going to get you into the x-ray room so that we can get you some x-rays. We're going to do a exam on you after your x-rays. And then after that, I'm just going to do some findings on you. We usually do that on day 2, but today we're going to do it all in the same day, okay?
Okay. Sounds good.
So the first thing is we have 3 main goals of our office. We like to get people out of pain. That's our first goal, obviously, because most people are in a lot of pain. We like them, after that we get them out of pain, to regain their function. So being able to do everything that they want to do in their life and everything like that. So a lot of people, they're like, oh, I can't garden anymore because of this pain. So we like you to regain your function. And then we want you to maximize your health. So just getting you out of that doctor's, the MD's office, and more into our office, and keeping you nice and healthy. Our philosophy is we are wellness-based practice. So we work our hardest to get people out of pain, get them back into their normal lives so that they don't have to sit on a couch, they're not in pain, they're not taking aspirin every day. And we just try to get them back into control of their lives. And we like to do that by eliminating thoughts, traumas, and toxins, which are the 3 T's, especially when it comes to chiropractic. Those are our big T's that we like to get rid of. So now I'm just gonna quickly take you into, I'm just gonna actually get your introduction about what's going on with you, what's causing your pain today, and everything, and I'm just gonna write a little bit about it when you're talking, okay?
Okay.
Ready?
Yeah, so I've had some back issues since I was little. I was a gymnast growing up, so I took a lot of pounding, especially with my lower back. I've also had some hip issues and some knee issues that no doctor really has been able to tell me what was wrong. Every time it would start bothering me, they'd find a new diagnosis for an injury, and then send me to a physical therapist, and then just kind of send me on my way. And that nothing really, it got better, but it never really went away. So I'm interested in trying to find the cause of some of my problems.
Do you have any idea what could have caused this?
Well, I was told I tore a muscle in my back when I was 12.
Okay.
But that was my 12-year-old understanding of it, so I'm not quite
what were you doing when you were 12?
Gymnastics.
Do you know? Okay, so
Yeah.
gymnastics. So you're a long-term gymnastics? Okay.
Yeah. So
How long have you been playing?
Since I was
doing
3.
gymnastics?
Okay. Since I was 3, so around 20
And you're
years.
23?
Yeah.
So 20 years?
Long time. And then I also have a lot of GI issues, so my stomach is very sensitive to a lot of different foods, and if I eat like larger meals, so if I were to go to a restaurant and eat like half of what they give me, my stomach always hurts afterwards, no matter what it is. So.
And when did you notice that the pain started? Probably the worst.
The worst was about 4 years ago.
Okay. And you said it generally started when you were 12?
That's the back pain. My stomach issues started around, like the worst part of my stomach issues started 4 years ago. Yeah.
Okay. And then back was when you were 12. Okay, cool. And then is there anything that makes your back pain better or worse? We'll talk about the GI stuff a little bit later.
Yeah, so rest, obviously, when I'm not working out, which is not really an option, is just to stop working out.
Right.
And then sitting makes it a lot worse, so obviously not sitting.
Is there anything else you do in your general life that just really irritates it? A lot of exercise?
Heavy weight lifting makes it
Do you do
worse.
a lot of heavy weightlifting?
Yeah.
Why?
From the military.
Oh, you're in the military?
Yep, I didn't mention that part.
Oh yeah, that's good to know actually.
Yeah.
Because if you're having that much pain while you're in the military, you definitely need this.
Yes. So honestly, everything that puts a lot of weight on my back or on my hips makes it worse.
That's good to know. Do you have any radiating pain?
Not
Pain that starts in one area that like travels?
Not one that like directly travels. Like if my back's hurting, I don't feel it like shoot down my leg or anything.
Okay.
But I can tell that like when my back starts hurting is often when I also get like knee pain as well. So I can't like feel it shoot down my leg, but I
so
also
it's
get
more like a referred pain.
Mhm.
Okay. Which
Yeah.
referred pain is pain that you have in one area that you may not think is directly related, but it could be directly related just to your back pain. So you are having referred pain in your knee. Can you point to the area on your back for me?
So it's mostly like lower back, so right at the base of my
Okay,
spine.
so like lower lumbars. And do you take any medications for it? Have you seen, you said you've seen a physical therapist, obviously, so you've seen doctors for this.
Yep.
Have you been diagnosed with anything?
No, not by a doctor. I've gotten MRIs and I've done stuff. I've dislocated my knee a few times and had a couple injuries here and there, but nothing chronic or systemic.
And do you drink alcohol? You don't? Okay, do you do any recreational drugs?
No.
And have you had any, you said you had a surgery on your knee.
No.
Have you had any, you haven't had a surgery?
Mm-mm.
Oh, okay,
No.
you just, they
Just
said
had-
you dislocated.
yeah, just
Okay.
issues with it,
Have you
yeah.
had any surgeries?
I had my tonsils out when I was 13, so that's it.
Okay, that's the only surgery you've had? Perfect. Okay, so I think I have everything I need. As of right now, I think we're gonna move on to x-rays. Are you ready?
Sounds good.
We're just gonna go into this room over here. Okay, now that we are done with x-rays, I am going to do an exam, and I'm gonna, since most of your pain is in your low back, I'm gonna start with a lower back pain exam. So I'm actually gonna have you turn around on the table, and I'm gonna just check for movement of your pelvis. So I'm gonna check your pelvis, and then I'll check your lumbars, and then we'll go into everything else.
Sounds good.
Okay, I'm just gonna contact your waist. Is that okay? Actually, I'm gonna explain to you. I'm just gonna touch your waist, maybe just a little below your waistline. Is that okay if I take your pants, or your shirt out of your pants?
Yeah.
And just if anything hurts or anything, let me know. Okay.
Sounds good.
Everything you say to me today is also held in strict confidence. Okay. Is it okay if I undo your waist? And go ahead and bend forward. Okay. And then go ahead and do a right, perfect. And then bend to the left. Okay. And then I'm gonna have you cross your arms for me, perfect. And I'm just gonna reach around you, is that okay? I'm gonna lift you up and then bring you down. Ooh. And then I'm gonna bring you towards me, okay? Okay. And then I'm gonna laterally flex you. Perfect. Okay. You can go ahead and put your, okay. So since I've done my exam, I'm gonna just tell you right now, I'm gonna show you your x-rays in just a little bit. But from what I'm seeing is I think that gymnastics you did for so long has caused a little bit of disc degeneration in your lower back. Do you know what disc degeneration is?
I don't. What is disc degeneration and how could gymnastics have caused that?
So in between each of our vertebrae we have a disc. The disc is full of nutrients and fluids that just helps, it's kind of like a gelatin type or like a sponge is a great way to explain it. And constant loading on those discs can cause them to lose their nutrients. And constant movement of those discs can cause, or like too much movement, hypermobile segments is going to cause those discs to decrease in their fluid, and it could cause them to become hard and crusty. Which is what we're kind of seeing. You're not quite there. You have a stage 2, so you have loss of the squishiness, kind of how I would explain that. And what we're going to try and do with your care is kind of try and get that disc to get a little more of its squishiness, its sponge-like. So right now it's like you have a dried up sponge. We want it to be nice and wet. And so we're going to work on that.
Is there a way to reverse disc degeneration completely?
Not really. I mean, we're going to try and get some fluid in there, but and it is possible that it could get better, but you don't want to get your hopes up because everybody reacts to treatment differently.
Okay.
So really quick, I'm going to tell you about chiropractic before I tell you what our plan is for you. But I just wanted to let you know your main issue is definitely going to be that L4, L5 disc degeneration.
Okay.
So what is chiropractic? Most people think that chiropractic is popping bones. That's all I hear about. Oh, do you want to crack my back? No, chiropractic is more finding a subluxation and fixing it.
What is a subluxation?
So what's a subluxation? That's the next question. A subluxation is going to be a vertebrae in your spine that has moved. It could be the spine could be moved from it, or just the body, or it could be posterior. But anyway, in that case, it just means that it's moved out of its correct location.
Okay.
And generally our innate intelligence, which is our body's way of healing itself from the inside out, is going to fix that. But sometimes it's just too much that our innate intelligence can't take care of it.
Okay.
So us as chiropractors, we find that area that's causing the issue, and we're going to try and push it back to allow our innate intelligence to take over and keep it in its space.
Okay.
Sometimes it's been subluxated for so long it takes a lot longer than what you're expecting. You're thinking, oh, maybe one time and I'll be good.
Yeah.
But a lot of the times it takes a couple of tries to get that back into the original position.
Okay.
So then my plan for you, since you have the disc degeneration, is we're going to do 2 times a week for 5 weeks.
Okay.
After 5 weeks, we'll do a reevaluation of your back.
Okay.
But I want you to come in. We're going to focus on your lumbars, and then any other areas that you might be having issues every week. If you're like, oh, I have really bad headaches, we're not going to dismiss that. We'll talk about that. But since this is your main complaint, that's our main focus.
Okay.
And then, so we're going to do that, try and get that disc degeneration a little bit better than where it is.
Okay.
If we can. We're going to work on those thoughts, traumas, and toxins since you have done Wellness Way testing, since you have tested your sensitivities to your foods, we definitely want you to get rid of those sensitivities in your diet.
Okay.
And then for your GI, we just really want to get those levels back to normal because your hormones are really not doing well. So we're going to start with taking out those food sensitivities, see how you do, maybe give you a couple of supplements, but we'll talk about those next time you come in.
Okay.
Do you have any other questions for me?
At what point do you expect things to change? Like, do you expect things to get better right away? When you're reassessing, what do we do if there's not a change or things get worse?
Yeah, so we have that a lot where people get really discouraged because after the first 10 sessions, they aren't seeing any improvement. Sometimes it just takes a little longer. You're quite a bit younger than a lot of our patients, so it might be faster. It could be longer because you have had this probably for a long time since you are young and you already have disc degeneration.
Right.
We're gonna just plan on going by ear. If we start to see improvement, awesome.
Okay.
If not, we don't want to get discouraged, but just remember that it is a process and it's going to take time.
Okay.
It's like learning how to do gymnastics. How long did it take you to succeed?
Right.
Our bodies are the same way. They're just trying to fix themselves, but it's going to take a long time. It could take a long time. It could be really fast.
Okay. Why is it important to do the Wellness Way testing in addition to chiropractic? Because you mentioned that chiropractic allows your innate intelligence to be more active in the body and do its role in healing. So why is it important to do the wellness weight testing on top of the chiropractic adjustment?
That's an awesome question, because when we have a toxic environment, which is where it comes when thoughts, traumas, toxins are a huge thing. So when our gut is all messed up, when our hormones aren't where we want them to be, it really causes issues with the body. The body cannot fix itself from the inside out, because we already have so much going on. It's overloaded.
Okay.
So we're just trying to fix those things a little at a time, starting with food sensitivities. Let's get those out, see if that'll help your lower back. After that, we'll work on giving you some supplements to help with your GI and see how you're doing, and maybe work on some of those food sensitivities that have been causing you a lot of issues that have been making it hard for you to eat.
Okay. How much is it going to cost?
So today we do a free consultation. First session will be about $85.
Okay.
And then after that, we have a 10 session plan.
Okay.
So if you buy all of your sessions at once, it'll be cheaper than if you were to buy them individually.
Okay.
So we'll talk about that at your next session with our financial advisor person, and then we'll get back to that. But generally a session is $85. If you pay for all of them at once, it's about $60 a session, which is a lot cheaper than $85. And then if you have health insurance, we'll talk about that as well.
Okay, sounds good.
Okay.
Yeah.
Thanks. It was so nice to meet you.
It was nice to meet you too.